There are two major tests that we do for this. One is called the antigen test, and the other is the PCR test. The PCR test is the more reliable test because what it does, you get a nasal swab, and then it amplifies the genetic material that is coming from the virus. So it is a more reliable test. The problem is that it takes a longer period of time. It takes a day to 2 days to come back, depending on where it is sent. And that is a more trusted test. The antigen test, now it gets a little more complicated here because there are multiple antigen tests that are available on the market. And depending on the test, it can vary in its reliability. One thing that I always tell my patients is that if it's a positive test, I want you to think and trust the test that it is positive. If it is negative, you still have to look at your symptoms because the reliability of a test can be low. You can miss between 25 to 30% in some of the tests. Some are better than others, but a negative test does not mean that you're negative. That's why you monitor the symptoms. And if you have been exposed, you absolutely need to be careful about infecting others. So for an antigen test, a positive test means that you must isolate or quarantine. A negative test is not 100% reliable test that you are negative. I hope I answered that question so that it's clear.
Well, I don't know if anything will ever be clear to anybody anymore, but to the best of your ability, that was pretty good. So I think another question that comes up, and so how many days after a positive COVID test will you continue to test positive? Like if you're positive 1 week on a PCR test, will you test negative the next week? Or there's some confusion around the how long do you retest and how long you remain positive?
So ideally, you should test negative once the infection is over. And I hate to say this, but I have had a patient who tested positive for 3 months after the infection was over. So you are not infectious in most of the studies that we know of 10 days after you have had COVID. But if the test is positive, it's more likely that the PCR test will continue to be positive because the genetic material of the virus may persist. So it can persist for a longer period of time.
I guess that segues to my next questions. I think people were asking, how long are you contagious? And then more specifically, the phrase that's been going around is shedding virus. And I think people had a question, what does that mean, shedding a virus? Have we become like snakes, or is there something else?
Okay, let me answer this in 2 parts. How long are you contagious? And I'm going to focus primarily on the Omicron, the new virus that we have right now, because it's almost like 99% of the infections that we are diagnosing in the US are this particular virus. The different forms of viruses have different incubation periods and infectivity periods. What that means is how long does it take the virus to cause a disease? That's called the incubation period. And infectivity is when you actually have the disease, how long are you going to be infectious? So looking at this particular virus, first of all, I think all of you know that it is highly transmissible, way more than the other viruses. So it transmits very easily. You're usually infectious 1 to 2 days before symptoms set in and 2 to 3 days after that. So it's really important to be very careful during that period of time, because you are going to be very likely transmitting this to anyone that you come in contact with. This again is from all the variants that we've dealt with, this one is the one that is most transmissible. I think I saw a study somewhere where it said 15 minutes 5 minutes breaks and 15 minutes total over a period of and at a 3 feet distance, not even a 6 feet distance. So I think that is the important thing to remember. Couple of 1 or 2 days before symptoms and 2 to 3 days after symptoms is your maximum transmission capability. Now, coming to the second part of the question that Dr. Kelly asked was shedding the virus. What that means is, the virus is a live organism, and it basically, this particular virus infects the nasopharynx, which means this area or the upper respiratory tract. And every time you cough, sneeze, talk, sing, if you remember, some of the initial cases were people that had got infected in a choir singing in a church. The amount of virus that is released is called shedding the virus. And we look at how long can somebody continue to be infectious by the amount that they're shedding. Generally, infectivity is related to how much virus you have that you can transmit to another person. And that is the period of maximum transmissibility, like I mentioned, before symptom onset, a couple of days after symptom onset. But some people can go on shedding virus. So they still have virus and it's called shedding virus, so that they can be infectious. So that's where that term comes from.
So here's where it even gets more confusing. If you're COVID positive or you suspect, how long should you isolate? I think they've changed some of the isolation period.
Yes.
I'm really hoping to throw you off here. I think I've got enough questions. I could probably do it, but so far so good.
So that I can understand how difficult it is for everybody, because we realize that the guidelines change continuously. We know from this particular variant, from the Omicron virus, and coming back again to the percentage of infections that we have in the US right now, more than 99% is this particular virus. So we have narrowed down the time that you need to isolate or quarantine, because we know that the period of infectivity is shorter. So now the guidelines say 5 days. What that means is that if you test positive, so actually, let me go back a little bit, and I'm just going to explain the two terms of quarantine and isolation. Quarantine is a lesser form of an isolation. So supposing I go out and with a walk with my friend, and she says, oh, I just called you to let you know I'm positive. Now I have no symptoms at all. So what am I supposed to do is to quarantine. What that means is I put on a mask, I stay away from most people, I monitor myself for symptoms, hoping that I don't turn positive. Isolation is a stronger form of quarantine. You'd isolate when you test positive, or you have a very high suspicion that you're going to get COVID or you have COVID. And that means isolating from people in your home, not interacting with anybody, staying in a separate room, having a separate bathroom, having separate utensils. All of that, it comes into play in terms of isolating yourself. So once you test positive, you should isolate at least for 5 days. At 5 days, you're going to do a test. And if the test is negative, you can come out of isolation, but you must keep your mask on and be very careful. So you're kind of now switching on to quarantine, where you have your mask on, you're not interacting with people on a free basis, and you're going to do that for 10 days. So that's the new guideline. So 5 days, if you test negative, then you still keep your mask on for 10 days.
And so just to clarify, because I think there was a specific question. So should you isolate within your home if other household members are COVID positive?
If they're COVID positive, then what you mean, let me clarify the question. So you mean that everyone in the home is now COVID positive or COVID negative?
So you have, let's say, one member of your family, and I should have gotten on this. We should have had this last week because let's say my daughter tested positive, and so then the question becomes, unfortunately, it's very difficult because she requires support, but you're trying to, as much as possible, you're trying to contain in the household. So if you have one member of the family, I'm assuming other members of the family should try to isolate if possible.
Yes, so with a child, the situation becomes very different, but I'll come back to that. But if one person is positive, they need to follow the isolation guidelines as closely as they possibly can, which means at this time wearing an N95 mask, and I'll come back to discuss the masks a little bit later because I do want to make sure everybody understands that, and to be as separate from the individual who's positive as much as possible. With a child, it's fairly complicated, but again, you follow the same guidelines. You want to keep them, if they are older than 2 years of age, you want them to wear a mask. You certainly have to wear a mask, and basically stay as safe as you possibly can.
One of the other questions that we get, and you're speaking about Omicron being the most dominant right now, are there significantly different symptoms of Omicron, Delta, and just your standard cold and flu?
Yes. The first thing is actually I saw in the newspaper today that Bill Gates had said that the Omicron is like the flu, but I wanted to say that I would disagree with that because the number of deaths that Omicron is also causing is very significant. I saw the number yesterday that we're at about, it was 1,700 a couple of days ago, and it's 2,000 a day at this time. So the flu is also from something very similar to the coronavirus. They're kind of from the same family. But and the specific thing about coronaviruses is that they change themselves on a continuous basis. So I want to use the analogy of the flu to explain the Delta and the Omicron. The flu, why do you need a flu vaccine every year? Because the virus that was there a year ago is now not the same virus. It's a different virus. It has changed itself. That is a characteristic of these viruses, that they change themselves so that they can be successful at infecting many people. So that's why you need a new vaccine every year. So that's the flu. The flu symptoms can be very severe. That's why we always advocate for everyone to get a flu vaccine. It is infectious, but generally, most people don't have the level of severity of infection like they are having with the coronavirus, the Delta virus especially. So the Delta virus has a higher pathogenicity. The reason it is more problematic is it will have similar symptoms to flu. So all these viruses belonging to the same family have similar symptoms. You have backaches and leg pain and some runny nose and maybe fever. But the things that are very specific for our coronaviruses, our COVID, is the fact that it can cause a loss of sensation of smell, a loss of sensation of taste, and the significant shortness of breath. So the hypoxia is less oxygen in the body. The problems that you see with the COVID viruses is much more significant than what you see with the flu virus. There is a difference between Delta and Omicron. The reason that Delta killed so many people and was so bad in its ability to infect everyone and cause significant illness was because it infects the lung tissue. So when the lung tissue is infected, your ability to have oxygen in the body and your ability to breathe is both impacted. And that is why so many people ended up in the hospital very sick. With the Omicron, It does infect some part of the lung, but it's hanging out more in the branches of the lung, not so much in the lung tissue. So its ability to kill is lesser. It still is there, but it's lesser than what the Delta virus was. I think, Tom, is there clear enough, or do you want me to add more detail?
That is very clear. And you know, it's interesting you say family. It kind of brings me back to taxonomy. So you have like a number of different members of the cat family. And I guess the standard cold would be like my my house cat, and Delta would be like a panther. Different variants. I think in talking about the severity of symptoms and different symptoms, a question that's come up is, at what point do you think about seeking medical help, or you go to the doctor, you go to the emergency room?
Okay, first of all, the analogy is great, Tom. The Delta really is a panther. Whenever I get a call, and I get a lot of calls from patients that are testing positive, I go over the symptoms with them and what to watch for. And the most important thing is shortness of breath and fever. So, and other symptoms, like you feel really unwell. So if you have tested positive and you're walking around, you're not short of breath, you don't have a fever, you don't have a bad cough, you can monitor yourself at home. But if you start getting short of breath, your fever is spiking, you're getting more fatigued and tired and dizzy and feel disoriented, that's definitely a time to head to the ER. It is now we have the pulse oximeters freely available. I do recommend it that if you have that, you test what your pulse ox is. What that tells you is how much oxygen you have in the body, and it should be more than 94%. So if you have oxygenation levels of 80, that is very concerning. That is not a good number. So I think it's important to remember that the oxygen level in your body should be 94 or above. And maybe I would take a 92, but anything less than that is always a thing of concern. So that's when you head to the ER.
And I know that as this has been evolving, we've developed new treatments. Are there a number of treatments that you can expect if you go to the emergency room, if you really are sick from COVID?
Yes. So there are a lot of treatments that are in development, but I won't go there. I want to talk a little bit about what we have now. So I think everyone has heard of the monoclonals. The important thing to know is that we have three main monoclonals that we were using. Two of them do not work for the Omicron. So the only one that works for the Omicron is the one that is made by GSK or Glaxo. So that is the one that we are using now. That is the only one that is effective against Omicron. The other two monoclonals are not. They're effective against Delta and the previous forms of the virus. But like I said, our main problem at this time is the Omicron virus. There are two treatments. And let me actually come back to the newer ones later, but in the hospital, we are using remdesivir, which is a medication made by Gilead. It's an IV infusion given over a period of 5 days. That does help with reducing severe consequences. We also use steroids. So steroids, I think a lot of people have heard about that. We use steroids for multiple reasons. Hydrocortisone, those are steroids. The one that we use is called dexamethasone, and it's an IV infusion. And the reason we use steroids is because steroids decrease inflammation. So they are very helpful when your lungs are going crazy and your body has inflammation. The steroids will dampen down that inflammation. So that's the reason for using steroids. So that's what we do when you are in the hospital. But now we have two other medications. One is a medication by Merck, molnupiravir, and the other one is a medication called Paxlovid that is formed by Pfizer. I want to explain a little bit on these medications. The reason we are able to develop viral medications, remember that viruses live within our cells. So it's very difficult to target an organism that is living within your cells. It's easier to target bacteria. If you have a strep throat, I know that if I give you an antibiotic, the strep throat is caused by an organism that is sitting outside on your body. I can treat it a little bit easily because it's more accessible. Viruses are not very accessible because the way they cause diseases enter into your own cells and cause all the problems over there. The reason that we are able to develop these medications is primarily because of HIV. Over the last 20 years or more that we've had HIV medications have taught us how to treat a virus that is living inside a cell. So these two drugs are based on that knowledge. So molnupiravir has not been shown to be that effective. It has to be given at the initial stages of disease. Actually, both of them do. And its efficacy is not as good as Paxlovid. Paxlovid is a protease inhibitor, and it has a medication that enhances its ability to be a good medication. It is a good medicine. The drug that enhances its ability is called ritonavir, and that has very significant drug interaction with a lot of medications. So there is a concern here, and we want to teach all doctors and primary care doctors who will be treating patients that they must look for drug-drug interactions when they are using Paxlovid, because of the fact that there is a drug to enhance its ability called ritonavir, which can have very significant drug interactions and also somewhat dangerous interactions with other medication. The other thing about molnupiravir, I'm going back to molnupiravir, is that there is some concern that it can cause fetal toxicity, so should not be given to a woman who's pregnant.
You sound like one of those commercials for a new pharmaceutical with all the disclaimers at the end of it. So it looks like a great drug. Unfortunately, there's about 50 different things it could do to you. I guess that's true with any drug.
Exactly.
So you'll not be surprised to know we have a lot of questions about vaccinations. And one of the first ones up, I think Chris Rock compared the Johnson & Johnson to the food stamps of vaccinations, I think is what he quoted. And I think there's a lot of concern if you initially had the J&J and can you get a booster with another vaccination, like with Moderna and Pfizer? And I guess in general, can you mix and match? What's the science with that?
Okay, so first of all these three vaccines are very good. J&J is a good vaccine as well as the RNA vaccines. So if you got the J&J first, you're certainly able to get the J&J vaccine again, and you can get it 2 months after getting your first J&J vaccine. And it's safe. It's a good drug. It's effective. It's a reliable. I shouldn't say drug. It's a reliable vaccine. So the two RNA vaccines from Pfizer and from Moderna are very similar. So you can certainly mix and match more than 5 months after you've had, we're doing 6 months, but more than 5 months is okay to get a booster. So if you've had Moderna, you can get a Pfizer booster. If you have Pfizer, you can get a Moderna booster. If you have J&J, you can get either Pfizer or Moderna. It doesn't really make that much of a difference. The bottom line with vaccines is, what do? They boost an immune response. So you already have an immunity developed because you got an initial vaccine. When you get the booster is just going to go in and boost your ability to now have a good immune response. So it's totally fine to do that. I get that question a lot because in our clinic, we gave Moderna and J&J. Pfizer needs special storage capabilities of a certain temperature that it needs to be kept in. And most clinics or smaller places won't have that ability. So you would get it at a place which has that specific a freezer temperature that they can have, like pharmacies or major hospitals. So if there's a problem with you getting your booster with Pfizer, Moderna is totally fine.
So it's kind of like with celebrities, they have to keep redoing their Botox to make sure that it's current. Is that?
I certainly hope it doesn't happen as many times, Tom.
Yeah, let's hope not. So, and are there additional symptoms that come with a booster or different symptoms than you would expect with the initial vaccination?
So most of the time it's been less or similar. In my patients, I haven't seen a more severe reaction. It's been around the same, and most of the people have had lesser. So they've had arm pains and aches and nothing significant or more prominent.
I think one question one individual had asked that said that my child is immune compromised, has strong allergies. I'm afraid of how my child will react to the vaccination. What would you say to the individuals or individuals in general that are worried if they're immune compromised or have a history of allergies?
So let me answer this in two parts. First, let me address the allergy question. So if you have allergies to different compounds or a history of allergic reactions, it is really not something that you should be afraid of in getting the vaccination. So the vaccine allergic reaction or adverse reaction that we're talking about is called anaphylaxis. Anaphylaxis happens, if you remember, like people who get stung by a bee, and they immediate or they have a peanut and they have this immediate anaphylactic reaction. So that's why we watch you for 15 to 30 minutes, because that is the time, if it is going to occur, it is, nothing is 100%, but 99% of the time it will happen during that period of time. If it happens, it's, first of all, it happens very little. It has nothing to do with your allergies and what you've had allergies before to. There is a compound called polyethylene glycol that is in the Pfizer vaccine, and it's highly unlikely that, at least I know of nobody who's had an allergy to it or has, it's used in some tests like colonoscopies and some other tests and all of that, but it's an unlikely allergy. If they have an allergy to that, then they shouldn't get the vaccine, then they can get the alternate vaccine. But otherwise, having an allergy to different compounds, even severe allergies, we will monitor you and we will see that you don't develop any reaction. And if you do, the treatment is really very simple. I think everybody has heard of EpiPens. Why do people who have anaphylaxis history to peanuts or whatever carry an EpiPen? Because it's a simple shot. You just put it in your arm and the reaction stops. So that is the question about the allergy. Tom, what was the first question? I forgot.
The other question was with folks that are immunocompromised.
Yes. So if you're immune compromised, which means that you have less of an ability to mount a reaction. People who get monoclonals for different things like Crohn's disease, rheumatoid arthritis, people who have SLE are immune compromised for, there's many reasons one can be immune compromised. Cancer, chemotherapy, it is all the more important to be vaccinated, because if you're immune compromised, the likelihood of a disease having severe consequences is very significant. And a vaccine is to protect you from having that. So if you are immune compromised, it is really important to be vaccinated. You should not vaccinate, you should vaccinate.
Another question that comes up, and there's been different protocols, different businesses, schools. Why do protocols differ for people who are vaccinated versus those that are not vaccinated, since it seems that both can contract, carry, and pass COVID?
Okay, so people that are vaccinated. So when you have an infection, if you're unvaccinated, the viral load or the amount of virus in your body is higher. Your ability to transmit is higher. If you are vaccinated, you have more of first of all, you will not have severe disease. That is the whole logic that we apply for people to get vaccines, is that if you get vaccinated, you're not going to have a severe illness, and your ability to transmit is there, but not as significant as people that are unvaccinated.
Okay, another question that came up is, would I have just natural protection from the virus if I've already had COVID in the last 3 to 6 months? How often can I get COVID?
So actually, that's a good question, because when you get natural infection, you actually have really good immunity. And the reason that you have good immunity is that you have the whole virus. So I'm going to backtrack a little bit, because I do want everybody to understand this, that when you make a vaccine, like we did for the COVID, we took the part of the virus that was the one that the virus enters the cells with, and it's called the spike protein. And we made the vaccine against the spike protein. Why is Omicron so successful in infecting others? Because it has 50 mutations or maybe more now on the spike protein. So we took a certain portion of the virus and made a vaccine against that certain portion. Now, when you get infection from the whole organism, naturally, you're going to have different forms of antibodies in your body because you got the whole virus. So you're usually protected, or you have good immunity. The thought is about 3 months is a good time, but I also think that it does go on for longer than that. So you do have immunity for about 3 months, but that may also wane over a period of time. So natural infection gives you good immunity. Now, I think the second part of the question was, how often can you get infected? You can get infected again and again. And the reason for that is that you're not seeing the same organism. I think there's some kind of a saying that you can step into the river multiple times, but it's not the same river and it's not the same person, because every second changes, the river changes as it's flowing through. The virus is constantly changing. The job of a virus is to learn how to infect and how to survive. So it wants to learn how to evade any immunity that you have, any vaccine that you have made. How does it make sure that it can continue to infect a lot of people? And that's why we keep seeing reinfections. We are seeing a lot of reinfections, but the good part of this is that when we see the reinfections, we see the benefit of vaccinations, because with this level of infectivity, we are not reaching the death rates that we saw when we didn't have vaccines. So we can get infected again. There is no guarantee that a vaccine is going to protect you 100%, but what it will do is prevent you from landing up intubated in an ICU and, from worse consequences after that.
All right. And one of the other questions is, if you're pregnant, or if you're thinking about getting pregnant, is there any evidence that the vaccines are going to be more problematic for women that are pregnant, or is it going to cause fertility problems down the line for people?
So actually, that's a question I've been asked very often, Tom. It does not cause any fertility problems. There is no evidence that there is an issue with fertility. Now, it is really important. If you are likely to get pregnant, if you are pregnant, you must be vaccinated, because we know that the consequences. So why is it so important? Because pregnancy is an immune suppressed state, because the body is dealing with a foreign or half of a foreign organism in itself. So the body has an immune suppressed state where the immune system is not going to mount a huge response against the fetus that is developing. So in that circumstance, women who are pregnant actually are at risk of very severe consequences. And we have seen very significant illness with women who are pregnant. So certainly you should be vaccinated. There is no harm that is known. We vaccinate people, pregnant women or women who are planning to get pregnant, for all kinds of diseases, Tdap and flu and everything, because we want them and we want the baby to be protected. So antibodies that are formed or that are in the mother will be transmitted to the baby through, so the baby will get immunity. They're also transmitted through breast milk. So there is all the more reason that that should be a consideration, and pregnant women should get vaccinated.
So another question that's come up a lot, if it seems like with children, with younger people, that the severity of COVID has been somewhat more mild. So if you're younger, healthy, exercise, your child, and you seem like you're at less risk, why get vaccinated?
So there are many cases where this virus has killed very healthy people, athletes, people in the prime of their life. Being an athlete, being somebody who exercises on a daily basis, eats healthy, is absolutely no guarantee by how the virus is going to behave in your body. So it's good. I tell patients, it's good you take care of yourself. That's excellent. But the vaccine is needed here, because exercising and all of that is not sufficient to keep the virus at bay.
And I think you said before that if you've had COVID, it kind of develops a natural immunity. So if you already had COVID, why do you need to get vaccinated?
So first of all, the immunity wanes, and the vaccine, every vaccine has been developed to maximize the immune response. So the kind of immune response, think of it like getting like a rocket boost. The amount of immunity that you develop with the vaccine is not as good in terms of its strength and its maximum ability as you do with the vaccine.
All right, I'm going to try to even pronounce this question. So from our medical community, given that Pfizer has a higher number of myocarditis and pericarditis occurrences in males between 16 and 25, is it worth considering the COVID booster shot now, or is it better to wait for another round of COVID booster shots if you have concerns about that?
So, there are concerns and side effects that one has to weigh for whatever therapy you're giving someone. Even if you're giving aspirin, there's a risk of bleeding. There's multiple risks that come into play. Medicine is all about balancing benefit versus risk. So myocarditis, what I have recommended is, okay, you can use another of the vaccines, because most of the cases have occurred with a particular vaccine. And the fact is that these cases have mostly been mild. Recovery has been really good. Again, it comes down to risking a possible side effect that is not very common, that is infrequent versus getting the disease. So I still recommend not waiting, because with the level of transmissibility that we have for this particular virus, we know for certain, and I think Dr. Fauci had made a comment that nearly all of us are going to get this. So you're risking a child getting that infection versus a remote risk of getting myocarditis.
And so segueing here, talking about masks, there's been so much said about masks. And one of the questions, at what age should you wear a mask? Like, does it matter regardless of age? Like, should young children wear masks?
So I actually think everyone should wear a mask. I think under the age of 2, it's very difficult to put a mask on a child. But as long as the child is able to comprehend it and is willing to do it, and you don't have to fight to put the mask on, it's a good idea to have a child be masked as well, because we do know, and we did see cases of children getting coronavirus. And right now we don't have vaccines for the very young kids at this point. It's important to protect them. And everyone should wear a mask whenever they are outside or in the company of other people. Now, there are different kinds of masks. And so I think I need to explain this a little bit, because the best mask that you can get is an N95 mask. Why is it called N95? Because it basically keeps 95% of the particles that are in the surrounding air out of your face, out of your mouth, I should say, or nose. So it's important to understand that the coronavirus is a respiratory virus. It transmits through droplets in the air and gets to whoever is close by. So when you're wearing an N95 mask, you are protecting yourself. And the reason that mask is really good is because it has a very tight seal. So if you put on an N95 mask, and I always tell patients, if you're running or exercising, don't do that, because you need enough oxygen. You don't need to wear a mask if you're away from everybody and you're jogging, because there have been some concerns with people jogging and wearing N95s. But if you're in the company of people in a crowded setting, N95 is the best one, because of the fact that it filters 95% of the particles, and the fact that you have a very tight seal around your nose and your mouth. So that's the N95. There's a surgical N95, which is used primarily by doctors when they are doing high intensity procedures like intubating someone or whatever. That's not for the general public. And I think that should be left for the health care providers who are doing risky procedures. So that's the surgical N95. N95, KN95 is also good. It's a little level, one level below the N95, but it's a very good mask. Now, and it also has a tight seal. Now, the surgical mask, the blue mask that you see people walking around with, is also very good. And the reason is because it has these layers, and the way that it is made is to protect things from going into your nasopharynx or your nose and mouth. It's the reason we are recommending the N95 now is because the surgical mask doesn't have a very tight seal. You put it on your ears and you put it on your face, and there is air that can filter through all four sides of the mask. Cloth masks are not good. We did that for a long period of time, and everybody got fancy masks and things written on them and all of that, but they are made of cloth, and cloth is porous. So depending on what I decide to take cotton, or I decide to take polyester or whatever, there will be a difference in the pores in the cloth and the way that it is made. And there is no way to know whether it's adequate in preventing the particles from entering. So N95, ideally when you're outside in a crowded setting, and at least a surgical, the blue one, whenever you're in a less crowded setting.
So cloth masks are out just like my my bell-bottom jeans, I guess. And it's too bad because I've got a really good 49ers one just ready for the playoffs, but okay. I guess another question that came up, are other variants, are we expecting other variants to be coming?
Oh, certainly. So the world, it's a global world. So that's one thing to really remember. The virus is not going to stop at the US border. All it needs is a ride on an animal, a plane, a box, or whatever it decides to travel in. And the world is, in the US, I think I may be a little off on this number, but 64% of the population is fully vaccinated. So that's not a great number. In Africa, or in South Africa, it's like 24 or 25%. So all those people that are unvaccinated everywhere in the world are going to get the virus, and the virus is going to mutate to find what it can do to change itself to become stronger, better, more smarter, and then it'll get on a plane or walk across a border or whatever, and infect the next person that it sees. There is already some concern about some variants that are occurring in the rest of the world that the WHO is tracking. And we should expect more down the road.
So viruses are just like computer hackers. They just get more and more sophisticated at breaking into your into your computer. All right, and I think just a few other quick questions, and then we're going to go for general questions that people may have that we haven't answered. I know it's one of the questions that came up. What is long COVID?
Okay, so long COVID is my what should I say? My weapon to convince my patients to get vaccinated. So once you get COVID, most of the people will recover, but there are a huge number of reports. Actually, Cedars has a long COVID section. Other hospitals are opening this also, is people who suffer from a variety of symptoms. Fatigue that is really persistent, just doesn't go away. Your ability to exercise. You were a marathon runner before, now you take 10 steps and you get short of breath. Patients, and this is what I've seen myself, is who get short of breath eating 2 morsels of food. So they eat and then they're short of breath. They have to wait to eat the next time to take them to start eating the next morsel of food. Dizziness, there's confusion. And the confusion is somewhat similar, has been likened to what happens after chemotherapy, where there's fog in the brain, the sense of taste and smell that doesn't come back to where it was. You're smelling a perfume bottle, yet it feels like burnt leather to you. And that may persist for a very long time. For some people, it's persisted more than a year at this time. And these are very debilitating symptoms. So we need to understand that COVID is not the flu. It is not something that is just going to come and be gone. It can persist for a very long period of time. At least at this time, we know that it is persisting more than a year. So that's something to consider, especially for people who think that they can wait and there's no need to get vaccinated.
So here's a tough question. With so many variants coming out and increasing transmissibility, and even what Dr. Fauci has said, it seems like everyone at some point will get it. Why take all these precautions? I mean, it seems like no matter what we do, we're probably going to get it. So why take precautions?
It's very important to take precautions. What is the main precaution that we want you to take is to get vaccinated, because we know study after study has shown that if you're vaccinated, your likelihood of dying from this disease is significantly decreased. Your likelihood of getting into an ICU, intubated and sick, is significantly decreased. So the fact that there is variance, the fact that, we're seeing this with Omicron, we are vaccinated, our main portion of the population that's vaccinated is not the ones that's ending up in hospitals. It's mostly the unvaccinated folks. So the virus will evolve. It will continue to change. At some time, it's going to become what we call endemic. That will exist. It won't be like this pandemic at this time, but we'll have sufficient immunity to deal with it when it shows up. So we have to continue to do the safety measures that we can do. And masking at this time is another of the measures we want to do, because we want to prevent ourselves getting sick. Even if it's mild, we don't want it.
Final question. So you're in an office pool with all the other infectious disease stocks, and you're trying to predict, when does this end? When do we go from pandemic to endemic? Saving the best for last for you, Dr. Bhatti.
That is like a really tough question, because, if you had asked me this question in 2019, I would have said, oh, maybe a month, 2 months, like MERS and SARS. MERS and SARS are the same family of viruses. They're also coronaviruses. And that is what actually I told people. When somebody said, oh, I'm going to Indonesia, can I go? I said, yeah, go. No problem. You'll be fine. And then I had to backtrack on all those words that I said. This is a very different world. I don't really know if I can predict it, but if we have a population, whether they have immunity by natural infection or they have immunity by vaccines, then we hope that we'll be able to change the pandemic into an endemic virus. I don't know.
I like how you weren't willing to give me a date on that, though.
It's so difficult to predict. I mean, I would love to say, 2-3 months, but I don't think that's the case.
Yeah. Well, thank you so much for being so patient with all the questions. And now you're going to have to be a little bit more patient, and we're going to open it up to questions that the audience may have. And,
Hi, Dr. Bhatti. We had a couple of questions come in while you were speaking. The first one was from Jay, and I will just read it. Hi, thank you guys for doing this. My question is, now that many people vaccinated and unvaccinated have gotten the virus, and therefore many unvaccinated people have acquired immunity that is at least as good as vaccine protection, will the vaccine requirement be lifted? Could an antibody test be considered as an equivalent like they are doing in Europe?
Sorry, say the last sentence, please. Antibody test?
Be considered as an equivalent like they are doing in Europe.
So the amount of immunity that you get when you get the natural infection, and I think I made this point before, is not as robust as the kind that you get from a vaccine, because a vaccine is specifically designed to really rev up your immune system and get as many cells as it can ready to attack. So that's the benefit of the vaccine. I am not sure about mandates, because it's a political, unfortunately, it's more or less a political issue, and different mandates are being lifted. I am an infectious disease doctor. I see what happens when you have an infection. I definitely do not want people to be not vaccinated. That doesn't mean that it should be mandated, but it is an essential thing. The antibody test is a questionable test at this point, in my opinion. And the reason is that for some people, antibody levels, so you have a high antibody level when you get the infection, but that antibody level can wane very quickly. And then I don't really know what to do with the level that is low, yet I know that the person had an infection. So I think the science on that is not very clear. We'll have to see where that develops. I am not so sure that I would trust an antibody test only at this time. I hope I answered the question.
Thank you. Next question that we have in the chat was from Georgina Dolores. Question, if Omicron is less contagious, why has the quarantine days been reduced?
Actually, the Omicron is more contagious. So the quarantine days, the reason for reducing those was, first of all, there are more considerations in terms of how it's affecting all kinds of service deliveries, all other job issues and all of that. But what we found out with this particular virus was that it has a limited period of high infectivity. So 1 to 2 days before you get the infection and 2 to 3 days after you get the infection. And most people are not contagious after that. So the thought was that if you decrease the period of quarantine or isolation to the time of maximum infectivity, then you are not doing any harm to the public by letting somebody out with a shorter period of quarantine. So that was the logic behind this particular variant, because it has a shorter, tighter period of infectivity.
Thank you. We had just a few more comments. Someone asked if this session was being recorded. It is being recorded and it will be distributed. The next thing that we had come into the chat was from Liz Spencer. This has been such a great information. Thank you, Dr. Kelly and Dr. Bhatti. Right now, we have no more questions in the chat. If there are any questions, you can go ahead, put them in the chat or raise your hand and I can unmute you.
Well, if there are no other questions, and Dr. Bhatti, I really want to thank you for your time. I really appreciate your knowledge through this, and I know that it's evolving for you as for the rest of us. So I appreciate you, and everything I know we're probably talking about might change tomorrow, but this is what we know so far. And I really appreciate everybody coming, and I appreciate all the questions that were sent to me. We're going to have another town hall like this. We're going to be talking about healthcare in the time of COVID in general, not just preventing from COVID, but taking care of yourself in general with dental care, mental health care, and just general medical care. So we'll have a bunch of other speakers coming that I am going to drill with questions. And so if you have any questions about like dental hygiene, just general questions about preventative medical care, make sure to get them to us, and we'll hopefully include your questions. So I really appreciate everybody here. And thank you, Stephen. Thank you, Sandy, for helping out with moderating this.
So I just want to say, check back on the website, on Westside's website. So the calendar, I will be posting the future dates soon, and I will be sending emails out to everyone for future events.